People sometimes think or ask, do I have to take anti-epileptic drugs?
If a patient was to say that they weren't keen on taking drugs or they would like to know about alternative therapies, I'd encourage them to think about it. I think the best chance you've got of getting seizure control is with medication, and there's an awful lot of research to support that. However, some people with particular syndromes might benefit from altering their lifestyle. If you have a syndrome called juvenile myoclonic epilepsy, we know that that will be directly affected by lack of sleep, by alcohol, and by stress.
Some people have specific triggers, so it's worth noticing any situations that may trigger seizures so you can avoid them.
If you can manage any or all of those situations, you could actually improve your seizure control quite effectively. So therefore, you could either reduce the amount of medication you use or perhaps choose not to use it at all. It's a very personal decision.
Of course, if you are thinking of coming off medication, talk to the doctor or specialist nurse, as AEDs need to be withdrawn slowly and with medical support.
The doctor left it up to me to decide whether or not I was going to go on to medication, and he counselled me and we chatted about it, and he told me the side effects, potential side effects of medication. But as my seizures started to increase, I decided that I didn't want to live with these seizures on such a regular basis, and so we started to discuss the potential medication, the possible medication that I could have.
There are other options which may work for a small number of people, such as managing your lifestyle, special medical diets such as the ketogenic diet, vagus nerve stimulation (VNS), or brain surgery like Sally had.
All the tests pointed to the fact that I would respond well to a brain operation, and within 9 months of first meeting Professor Duncan, that had happened, and I've never had a seizure since, and it's absolutely made my life move on no end.
However, drug treatment remains the best chance of becoming seizure-free for most people. I've spent the last few years trying to achieve seizure freedom by taking as little medication as possible and having as few side effects as possible, and in a way I don't mind taking the medication so much because I'm having not too many side effects and the medication is controlling my seizures, so I am able to work and have an active social life and do all the things I want to do, so it doesn't feel so bad taking the medication.